My name is Danielle Scafidi, and today I'll be talking about arteries and veins. I wanted to start off by defining the main system that arteries and veins belong to, which is the vascular system. The vascular system refers solely to the system of blood vessels, and I'll get into the specifics in just a second. I wanted to clarify because it can be quite confusing which systems we are talking about. For example, the cardiovascular system contains the heart, blood vessels, and the blood that flows through them. However, the vascular system and the cardiovascular system are often interchanged. Back to arteries and veins now. There are types of blood vessels, but not the only type. With the help of the heart, blood vessels transport blood, oxygen, nutrients, hormones, waste products, metabolism products, and much more throughout the body. Again, there are three main types of blood vessels: the arteries, the capillaries, and the veins. Arterioles and venules are subtypes of their respective blood vessel, but they mainly serve to connect arteries and veins to the capillaries, and so I won't really be covering them in this video. A little bit about blood flow and circulation before we move on. Blood circulates through two loops in the body, the pulmonary circuit and the systemic circuit. The loops overlap at the heart. I want to go through the circulation just so we understand exactly where blood is flowing and through what specific blood vessels. Blood is pumped from the right ventricle to the lungs through the pulmonary artery, where the transfer of carbon dioxide and oxygen originally occurs. Oxygenated blood flows from the lungs through the pulmonary vein to the left atrium of the heart. Oxygenated blood is pumped into the left ventricle, then weaves through the aorta through a system of systemic arteries. Oxygen is transferred to cells all throughout the body before returning to the heart through systemic veins. The blood is now deoxygenated and enters the heart through the vena cava directly into the right atrium, where it is then pumped into the right ventricle to begin the cycle again. You may have noticed that oxygenated blood flows through the veins in the pulmonary circuit, but through arteries in the systemic circuit. Similarly, deoxygenated blood flows through an artery in the pulmonary circuit, but through veins in the systemic circuit. This brings me to the definition of arteries and veins. It's a common misconception that arteries only carry oxygenated blood and veins carry deoxygenated blood. In reality, this is not always the case, and instead, arteries are distinguished as blood vessels that carry blood away from the heart, while veins carry blood back into the heart. The trick I usually use to remember this is arteries away, veins in. Before we move on to specifics about arteries and veins, I wanted to quickly cover capillaries because they're incredibly important despite being the smallest blood vessel. It's here that the majority of the exchange of nutrients and substances occurs in the body. You have capillaries connecting arteries and veins all over your body. In fact, you have about 25,000 miles worth of capillaries. Capillaries are also able to permeate every tissue in the body except for your cornea, and you don't have many cells that aren't within an arm's reach, or I guess a cell's reach, from a capillary. That's about 0.1 millimeters if you're curious. Some other fun facts about capillaries are that they're very, very small, about 8 micrometers in diameter. For reference, a human hair is about 100 micrometers in diameter. Back to arteries now. We've established that they're blood vessels that carry blood away from the heart. In the systemic system, which is the one that circulates blood to your body, they carry oxygenated blood. Arteries are also responsible for maintaining blood flow during diastole. Arteries are crucial for providing oxygenated blood to organs, as well as transporting various other substances such as nutrients. Therefore, they play a central role in maintaining homeostasis in the body, as well as ensuring proper functioning of other organs and tissues. The pulmonary artery brings deoxygenated blood to the lungs, where the exchange of CO2 and oxygen occurs, another critical process for survival. Arteries are under the most pressure as the heart pumps blood out of the left ventricle. Their anatomy supports their function and the pressures they're exposed to. They have a smooth muscle layer that also contains elastin. The second layer is a thick band of smooth muscle that allows arteries to constrict or dilate. The last layer connects the smooth muscle to other tissues in the body. Veins, on the other hand, are blood vessels that carry blood to the heart. In the systemic circuit, they return deoxygenated blood. They provide low resistance and maintain peripheral venous pressure. Much like arteries, veins are essential to maintaining homeostasis. The return of blood flow to the heart to be reoxygenated, as well as transporting other waste products through these vessels, is crucial. Arteries are under immense pressure. However, veins are under little or even negative pressure, despite containing 60% of the total blood volume in your body. This being said, their anatomy is quite different from that of arteries. The diameter of the lumen is larger than that of an artery, and they have one-way valves to prevent the backwards flow of blood. The wide capacity, thinner walls, and higher compliance compared to arteries allows for the greater volume of blood to be contained and at lower pressures than in arteries. Now that we've covered the function and structure of blood vessels, I wanted to revisit the concept of blood flow. Blood flow is achieved through a difference in pressure at the beginning of the vessel and at the end, and also moderated by the resistance posed by the vessel. Poiseuille's equation allows us to calculate the resistance within blood vessels given the pressure difference, vessel radius, viscosity, and vessel length. In order to effectively circulate blood and distribute to important places, especially in times of need, such as during fight or flight response, the body is able to constrict and dilate blood vessels. This is where the anatomy of these vessels comes in. Arteries' thick band of muscles and the high levels of elastin and collagen allow for vasodilation and constriction to occur. This allows the body to siphon blood off to certain areas. One type of testing that's done on blood vessels is known as vascular testing. Vascular testing is done to check blood flow in arteries or veins. This is done using an ultrasound machine that passes high-frequency sound waves into the region in order to measure the amount of blood flow occurring there. The blood flow in the vessels is measured as the echoes of the sound waves off of the blood cells. This test is done if a patient has signs and symptoms that indicate decreased blood flow to a region, such as leg pain or weakness during exertion, swelling of the area, soreness, tenderness, redness, or warmth, or oppositely, pale and cool skin, numbness, or tingling. The Doppler ultrasound is one subtype of vascular testing, the results of which are portrayed in graph form. The number and height of peaks indicates the level of the occlusion in the blood vessel. Results can vary based on where the test is performed, say in a lower extremity rather than an upper extremity. However, normal results to be tri- or biphasic with distinct peaks and valleys. This diagram on the right shows a range of Doppler ultrasound results for peripheral artery disease, which essentially obstructs blood flow in a few different manners that I'm not going to get into. However, using this graph, we can see that higher levels of obstruction coincide with smaller peaks in the Doppler ultrasound. The peaks get shorter, and there's less distinct variation in points as the obstruction increases. One disease that might prompt such symptoms is atherosclerosis. Atherosclerosis is a buildup of plaque on the walls of blood vessels, as you can see there in the figure on the right. Symptoms can vary based on location. If the buildup is in a vessel leading to your heart, you may have chest pain or pressure. If it is located in a pathway to a limb, you will have similar symptoms to the one I described last slide. If the plaque buildup is on the way to the kidneys, you might experience high blood pressure and kidney failure. And if it's before your brain, you might have sudden numbness or weakness in your limbs, difficulty speaking or slurred speech, loss of vision in one eye, drooping of one side of the face, or other symptoms consistent with a transient ischemic attack. The causes of atherosclerosis are not clear, but damage to the inner layer of the blood vessels does increase risk. This can be caused by high blood pressure, high cholesterol, high triglycerides, smoking, insulin resistance, obesity, diabetes, or inflammation caused from a variety of diseases. Another example of a pathophysiology of arteries specifically is abdominal aortic aneurysm, which is when the blood vessel balloons due to the weakening of the walls and the accumulation of blood in the region. There are little to no symptoms of what is referred to as AAA, but if you do experience any at all, There'll likely be pain in the abdomen, back, or side, as well as coldness or tingling in your hands or feet. The weakening of the artery wall is caused by a breakdown of the elastin and collagen that's present there. Surgery can be performed if there's a high threat level, but surgery is also risky, so doctors often don't operate if it's not entirely necessary. However, more recently, endovascular grafts have been used because they're less invasive and still have great results. This is my list of works cited, and thank you for listening.